So good morning, good afternoon, and good evening. Welcome to the 910th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you. Today we have with us Dr. Chandraja CV, PhD Microbiology, MSc Psychology, MSc Microbiology, MPhil Microbiology. Research Officer, Department of Medical Research, Sarvagashna Homeopathy Medical College, Kulasagaram, Tamil Nadu, India. Worked in different areas including as lecturer, researcher, and vice principal. Experience research in 13 years, academic 18 years. Presented 42 research papers and 24 paper presentations. Today's topic is ethical consideration in clinical research. Important topic, and we all know that she is the most able person to talk all these things in our platform as well as on the homeopathy matters. So on behalf of IFPH, I welcome Dr. Chandraja. You can have the platform for the next 45 minutes. It's over to you.
Okay. Thank you so much, sir, for this opportunity. So this topic research, that is ethical consideration research, is actually quite a very important topic, but we don't know what is the important points to remember and what should be ignored. So that there is a small differentiation between these two things. So we have to understand what are the very important ethical consideration when we do a clinical research and we go for a clinical research. So going over to this, I will open a page where we can actually go for this type of study. So, shall I start my presentation, sir, with your permission?
Yes, please proceed.
Okay, sir. Thank you. So this is the web page of NIH, National Institute for Health Sciences, and there is special page where it comes for patient recruitment. Well, you are recruiting the patient, is very important that we have to consider certain important points. It's just called as guidelines, ethical guidelines for while doing a clinical research. So this comes when enrolling the patient, when giving the patient the information about our study, and also getting a proper consent, informed consent from them. So not only that, there is a lot of other things which have to be kept in mind to do any study, which any study will be done based upon the benefits of this particular research for the public, for the society. But along with that, we have to keep in mind that our study is not going to harm the patient, not giving any type of issues or problems to the patient's self-respect, esteem, or any other rights, etc. So the goal of any clinical research is to develop new knowledge in human health sciences. And for this purpose, our drug, whichever drug we are going to use, should be safe or effective. They should not be like as I always tell that in any type of research, there is two important part, which is risk and benefit, or harm and benefit. Our medicine should be more beneficial rather than harm. That is why we always try to do toxicity study or preclinical study before going for a that is a clinical study. So the ethical guidelines is actually not a new thing which have developed. It has developed from a very, very long time, since 1947. Nuremberg Code, which was actually a important incident. It's a very important data which tells how to treat a patient while for a clinical practice and other than for a clinical research. Declaration of Helsinki, which is a very revolutionary part in there is clinical research, which actually this particular event led to laying down of ethical consideration in doing research, formation of ethical committees, and this started because of certain important incidents in the life of certain, or in the journey of research of certain important diseases like gonorrhea, etc. So the benefit, rather than benefits to the patient, a lot of harms were there. So to differentiate that, this particular even that is a code was there, Declaration of Helsinki, Belmont Report, so many things. The stories are like more than a what to say, disaster. So each came with a lot of disasters. So we will talk about it later, in later hours. But now we'll see what are the important considerations. Today's topic was important consideration for research. So the first consideration, social and clinical value. So social and clinical value, any research should add not only a value to the clinical part, that is to find out a new drug or something, but also the important benefit to the society by giving some output where the patients, society, and also the public is benefited. It should be, any study should be relevant to the public problems. It should not, what to say, it address a problem of very far end. It should address a problem of a very short end, very normal people, middle class people, likewise. Scientific validity, to add scientific validity where it is required, like how we homeopaths are doing to add scientific validity to our research, that one. Fair subject selection, do a very good subject selection. That is very, very important. Do not take anything which has conflict of interest. Then favorable risk-benefit ratio. This is another thing. Than risk, there should be more benefit. If there is 10 risk, 90 should be the benefit. Likewise, the ratio should be. Independent review, informed consent, respect for potential and enrolled patient. When you take a patient, you have to respect the patient, and also the enrolled patient should be treated with respect. Their rights should be that is well addressed. They should not be given any financial burden. They should not be abused. So these things have to be kept. We will not do it, but we doesn't know where we stand. So we should know what we are doing and what we shouldn't do. So every research study is designated to answer specific question. Answering certain questions will have significant role in finding out the validity of the research. And also an answer to the research question is very, very important. For this, our study will add that is knowledge to the present health knowledge. That is, we are trying to fill certain gaps, or a gap. We are trying to fill the unknown facts. We are trying to find out some unknown facts which we can do. We cannot find everything together. A small gap can be filled. So what novelty we are going to add to the research, that is very, very important. So our research should be giving some sort of weightage to the particular studies. And also there is important thing, that is our study should improve our ways of preventing, treating, and caring the people with a given type of disease. There is already certain treatment. Ours should be some sort of different methodology or protocol of treatment where we are trying to improve the standard of treatment. And as you all know, any study will have both negative and positive part. Here also, our subject should be helped rather than harmed. Next is about scientific validity. As we are doing, as homeopaths are doing, we are always trying to validate the truth, or that is, we are trying to show that our medicine is effective. Our medicine is acting in this particular way, in this particular patient, in this particular disease condition, or in the symptoms, or in preventing this disease. And so in this way, scientific validity should be added by doing a proper by adopting certain protocol, by setting certain objective, by setting certain methodology, and all this things should be done in a proper way, that we have to select the subject, select the patient in such a way that the number of patient, the type of patient should be able to give the particular answer. So, for example, when we do certain study like in diabetes, when we take a topic of doing a diabetic study, we may select all different types of patient for doing. And we are trying to give lycopodium or some other drug in treating diabetes, or constitutional remedy in treating diabetes. But we are taking different type of people, of all type of, like in a mild, moderate, all type of people are taken. But in that case, what happens is, when you compare the before and after value, we may not get statistical significance. This is because the range of blood sugar levels are, in certain condition, it is in 270, others will be 470. So this will not match with the homogeneity of the data. So computer is actually reading the data. It doesn't know whether the data is from different types of individual, not like, it is not going to differentiate. It will read this data, this particular data. It is not uniform. It is not having any pattern. So it is, when you are comparing with the different, there is another set of data that is after study. There also, there will, in before value will be 270, after will be 150. This before value will be 420, after value will be 370. So there is a there is an there is unequal difference in before and after value. So what happens is the statistical software will consider that the data is not uniform, so it is not significant, it is having extreme values. So in that, because of that, we may get a wrong that is significance. We may not find our study to be significant. So this is why in many places we are not able to ensure the scientific validity. So in this condition, we have to be very much careful in selecting the individual in a proper manner, so that statistical plans can be laid, suitable effective sample size can be selected, and we are trying to do the study in a proper manner. So invalid research study becomes unethical because we are wasting lot of resources, we are wasting lot of energy, we are wasting the what to say, the dignity, the respect of the patient. They came to us as a participant for our study, but what we did do, we didn't understand the research properly. We did some study and we wasted the whole part, the study as such. So what happens is we are trying to waste the money, energy, and the participation of the patient. So when you plan a study, the proper design should be taken, proper sample size to be selected, so that whatever research you are doing, it should be effective or it should be successful. Doesn't mean that the result should be always positive. The result can be negative also, but negative with valid negativity. That result should be reproduced somewhere. The result should be declared somewhere. The people may take the responsibility of it. Likewise. So when we are doing a research, we should be very much careful that the study should not be wasted. So the design, the number of sample size, all should be selected very carefully and wisely. Then fair subject selection. Appropriate subject selection is very, very important. As I told you, sampling. Many of the comments can be heard. The samples are not correct. Appropriate, inappropriate sampling is the reason for the failure of the research. What is inappropriate sampling? The selection of a sample, selection of the subject or selection of the patient for your study is very, very important. We cannot select the patient based upon the what is a very weird type of investigation, very particular, very substantial, very important or very relevant or reliable investigation should be taken for selecting a patient. For example, rather than going for random blood sugar level, we can go for HbA1c value when you're doing a clinical research, because HbA1c value is more relevant, more trustworthy, or more what to say, reliable than fasting blood sugar, or not fasting, random blood sugar. So this type of more, likewise GTT, glucose tolerance test, it is more reliable. So while we are selecting the patient, these type of investigation, which is reliable, valid, and stable, has to be taken. So the selection of fair subject selection is also important. Not only subject selection, type of investigation is also very important. Here, consistent with the scientific purpose, people should be chosen in a way that minimizes risk and enhances benefits to the individuals and society. Groups and individuals who accept the risk and burdens of the research should be in a position to enjoy its benefits. And those who may benefit should share some of the risks and burdens. Specific groups and individuals, for example, women and children, should be excluded from the opportunity for participating in good scientific reason because of susceptibility of risk. See, so another important term commonly called as vulnerability. What is vulnerability? Patients are vulnerable in certain cases because the patients who have certain issues, mental, mental issues, the mentally retarded patient, old age, children, who cannot judge their things by themselves, they have to be excluded from the study, because the taking such patient for the study may affect the validity of the study, because they may come across small risks which cannot be tolerated. Pregnant women should be avoided. Old age should be avoided. Small children should be avoided. Why? Any risk to those groups, it becomes unmanageable, and that becomes a difficulty. The people are not able to express their problem. See, I have aggravation. I am not able to sleep at night. These things cannot be communicated by those people. So these type of groups has to be avoided. Another important thing is about the favorable risk-benefit ratio. The uncertainty about the degree of risk and benefit associated with drug, device, or procedure being tested is inherent in the clinical research. I'll give an example for this. Earlier, for people who have sleep apnea or people who have snoring issues, there was a device connected to the face, which is actually attached to the face. They have to put just like a mask they have to keep. But maybe the snoring comes down, but the difficulty, the instrument is very not a handy instrument to keep. So in certain cases, in some people, it is difficult to manage. And always these, like, rather than giving a benefit, the people are not able to accept it. People are not able to sleep with it. So this becomes a risk. Rather than benefit, it becomes a risk to the patient. So it becomes a discomfort, or it cannot be used for a long term. So this is why this type of instrument has to be avoided. This type of instrument becomes unused by many people. So this is why it is called as a risk-benefit ratio is more. And another important thing is psychological risk can be not only there is risk, not only death is a risk, disability, infection, long stay at hospital. Maybe the patient came with some problem, maybe a backache. We treat them and the problem became an infection, a UTI infection, a blood infection, or a respiratory tract infection. So that is again a risk. In a very good hospital, the nosocomial infection is a very less issue. When in a hospital where the cleanliness or hygiene is not an important factor, what happens is people go to hospital and they stay for 2 days, they become ill. This is called as nosocomial infection or hospital stay infection. So this is very common in hospitals. And this is another important thing where the benefits are less, risk is more. So increased, they came for a back pain consultation, and they stayed at hospital for 2 to 3 days. And after staying, they got an infection, they are staying for 14 days. So there the patient's time is wasted, money is wasted, so many things. So this is why we tell it as an ethical. The pharmacovigilance department is there in not only in Ayush, but all the other sciences. Earlier it was there in allopathy. Now it has come in homeopathy to see whether the patients are harmed. Harming, as I told you, harming is not merely death. It can be an infection, disability, prolonged stay at hospital, psychological difficulty in getting the basic requirement, or what to say, like treating them in a very bad manner, long stay, long waiting, in consideration, so many things. When we stay at hospital, we expect the doctor to come and see us at least once in a day or twice in a day. But if you try your patients that has come to the IP and got admitted for your research study, and you are not going for rounds, you are not going to consult them, you are not giving a proper visit, you are not giving explanation to the questions they are asking, then that is also called as a harming. You are trying to harm psychologically. They came all the way to get treatment and trusting you, but that trust is being lost. So this type of things are also called as risk, harm to the patient. So in certain cases, people take certain drugs to reduce the certain disease condition, say PCOD or something, and because of that, they get some other problem. People take hypertensive drugs and they got liver issues. So this is all called as the favorable risk-benefit ratio. So our study should have always more benefit rather than risk. Then independent review. Minimum conflict of interest should be there. Whenever you present the research in front of others, there should not be more than, you see, like ethical committee will be there. Ethical committees, there are 9 people ethical committee. One will be the chairman, another will be the secretary, member secretary. The third will be a scientist, a medical scientist. Fourth will be a non-medical scientist. Fifth will be a social worker. Seventh will be a layman. Another legal person will be there. Another one will be the philanthropist. That is a holy person or a father or somebody like that, who is a learned person who knows the problems of the people, problem of the clinical research, the harm. They should be educated before having these members taken. They will be educated about the clinical research. They'll be given small education about the rights of the patient, and then they'll be taken as the members. So what happens is, when you present this type of research in front of the ethical committee, most of the people may disagree with certain things. When you are giving a medicine to old age people, or you're giving medicine to the mentally retarded people, they may say, no, it is not, you're doing a placebo controlled study. You cannot do that because these people actually are just a very good example. You're treating epilepsy. You're doing a research to treat epilepsy, that too a placebo controlled study. If you do a placebo controlled study for epilepsy and you may not get a proper result, your placebo group may have some people who have a very high risk. We are not having a proper management technique. What may happen? The patients will be harmed. It will be fatal for the patient. So in that condition, what happens is such research studies will not be promoted by the members. So there will be conflict of interest. So the members may say that we cannot go with the research because you are doing a placebo control study. And if the patient comes across some harmful events, what will be the step you take, or how will you manage it? We may not have a good answer to tell that. So in that condition, this type of study may have a lot of conflict of interest. That means not only in the research-based community, but also in front of the ethical committee itself. So ethical committee members may give a lot of recommendations, suggestions to avoid or reframe the topic. So we have to do that. Otherwise, this study becomes that is highly reviewed study, because the study has a lot of issues, flaws, problems, feasibility, because you may not get such patient. No patient will come to you having epilepsy, treating with homeopathic medicine where there is a placebo group. So if you don't have proper management or proper other system or reference to this, then the study may fail and the patient may get affected. So any type of study taken in this way, we have to do only in the people who are not vulnerable. In a healthy volunteers, you can do some studies like that. And the institutional review board, which we tell us in the ethical committee or review board, is actually monitoring these things. They are called as monitoring boards for independent review of any research for ethical issues. And the third, very important part, which we have to understand, which every practitioner has to understand, is getting an informed consent. This informed consent, when accurately taken, accurately given to the patient, they may read, understand, we explain all the doubts, and when they sign the that is consent form and give you back, it is not only adding confidentiality to them, but also to you. You are becoming safe because you explained everything of your study. You explained the flaws of the study. You explained the purpose of the study. You explained the need of the study. You told about the time duration for the study, everything. So we get that sort of confidence for doing this research. So not only that, when we do a study like that with a consult, any event come to the patient has some aggravation, or we may give placebo control trial, that we may not know which patients are given placebo, which patients are given medicine. But suddenly one patient may come and tell you that after taking a medicine, I have this type of issue. There is a dermatitis in my feet, or there is a hair that I'm getting hair fall, or I'm getting, my eyesight is getting blurred, something like that. We may not be able to tackle the problem, because unless we take a proper informed consent, we may say that anything concerning this research, I have given you complete information. All the issues, all the problems has been properly conveyed to you. So if you have any issue, I'm responsible to take up the problem. There is no compensation for this particular thing, but your treatment will be taken care of me. Likewise, there is a lot of points in informed consent. I will show you informed consent format also, which will help you to understand what are the main points included there. So informed consent is very important thing. It is a document prepared by an investigator or if a person who is doing the research in a very neat manner. The points are mainly title of your study, purpose of your study, duration of your study, who is your people, co-workers like guide or co-guide, or there is co-investigators, or who's like in certain studies we require, for example, you're doing some study for eyesight, you require ophthalmologist. You may do some study for the some sort of investigation regarding or having FNAC or a pap smear in your study, you require a pathologist. So with all the experts in this group, we may say, see, for this issue, we have a pathologist. For this issue, there is a cardiologist. So you need not worry about anything. We have an expert panel with us to help you while doing the research. So this may help us. There is some issue. My voice is overheard.
No problem. Please continue.
Okay. So in this way, what happens is we'll be able to safeguard our side with all sort of justice. And if there's some problem, as I told you, some people come with certain problem to us saying that I have this particular issue. So we are able to say there is a lot of there is a clause where we can help, which may help us to protect ourselves. So this informed consent is a very important thing which everybody should include. And informed consent, as I told you, may have title, purpose, the details of the investigators, not only investigator, expert panel also, where there can be a pathologist, there can be a microbiologist, or there can be a cardiologist, whoever is important, wherever there is a risk for these people to refer, these people may be there. So this is how the consent form will be organized. And also there will be promising statements telling that your dignity will be safeguarded, your documents should be kept in a safe manner, your name, anonymity means your name will not be disclosed. If your photos are shown in a picture, then it will be masked, but the eyes part will be masked, so that the whole picture is not evident through in a journal or something. If there is your any personal content of the patient will not be disclosed to anyone. Not only that, the blood sample which the patient is given will not be given to anyone without their permission. It is also called as your blood samples, fluids, body fluids, even any piece of hair which is taken for the study will not be given to anyone without the permission of the patient. So this is how we are interesting the patient to be added to the study. So all these points are very neatly arranged, and this adds a lot of confidence to the patient. And the patient, another important thing is, when the patient comes for the clinical study, we are not forcing them. So another point is, like, we assure that you can withdraw from the study at any point of time. That is also there in the clinical, that is ethical consideration, that the patient will be given full independence to judge or to take a decision that should I continue with this study or should I withdraw. There will be no compensation given for any sort of changes, or if the patients are coming, I'm giving 500 rupees per head for each visit. Not like that. There is nothing, no money benefits. There are a lot of things are happening in many research studies. In a commercial world, when you go, these are things which is happening, but this is not a law. And another important thing is, when you are given sponsored by a pharmaceutical company, or your medicines are coming from some pharmaceutical company, and you are doing a research for them, say a pharmaceutical company named X is giving a particular drug and asking them to give to all the patients having liver disorders, and we are giving randomly. Those who are having liver diseases, I'm giving the medicine. And this particular company is finally, after getting all the data, they are giving us allowance, say a foreign trip to European trip. Taking such things is also ethically ethical. There is ethical issue in even accepting such things. So such a certain proposals like that. Okay, after doing this research, there is a chance of you to go for a European trip. This is also a issue because we doesn't know what is the end point of the research. In a blind manner, we are giving the medicine. There should not be any benefit to the investigator other than this research. That is the most important thing. Except this research, there should not be any plus benefits for the patient, for the investigator. Otherwise, it is a ethical issue. Money, any proposals, any sort of discounts, all this has to be discounts. That is very common because once you purchase a lot of medicine together, discounts are very common because that is all coming as the marketing thing. But not that discounts means another offer for another 1 year, all medicines are free. Likewise, many invest not in homeopathy because homeopathy pharmaceuticals companies are very poor. Rather, when you consider the allopathic medicines, we are very poor. But allopathic side, the medicine value will be only 10 paisa, but they sell it for 6 rupees or 7 rupees. So those company can offer all those things. So so many issues has come because of this type of issues. These type of bribing proposals has led to these type of issues. So any that is compensation to the patient is also a crime. Another important thing, you have to give your phone number and your address to the patient. Phone number in case the patient is having any issue at night, or you have to pick the phone and answer. But recently, what happened? Recently, we had a clinical trial and we went for an camp and we gave medicine, arsenicum album. That was a medicine for the research. It was a small. It is in a pediatric study. What happened? The child had asthmatic problem at night. So the phone number was given by one of our investigators. There was a call from the parent. Doctor, my child is not feeling well. She's having asthma. So when you practically see, this is the issue. So what should I do? So the doctor is at home. She cannot come out. Okay, madam, you just do one thing. You can mix that globule in water and give 5 drops in every hour and just wait for 1 or 2 hours. After 2 hours again, the mother called the investigator and asked, still my child is feeling okay, but still she's having some issue. Okay, then the doctor told, okay, do one thing. She had a blessing dose she advised. Again, that somehow till morning, from 12 o'clock till morning, there was 4 phone calls given by the parent to the investigator. So these things are very common. Sometimes our norms are exploited. So we should be ready for all those things. But this is the thing. In consent form, we have to give all the details, phone number, address, and we should be ready to attend those phone calls and answer all the questions. Because the trust or rapport we built with the patient is very, very important. And not only this, when you for a pediatric age group, it is very important that we have to answer the question, because the mother as I told you, like vulnerability, the child age group is highly vulnerable. So in this condition, we have to understand the mindset and we have to attend those calls and give proper response for these things. So informed consent, I told you, accurate informed consent may have benefits of the study. What are the alternatives to the research? What are the situations where we have to take new decisions? Voluntary joining or enrollment and voluntary dropping out are there. And if there is any child or Alzheimer's disease or adult patient or any traumatic patient or mental patient with mental problems, they has to be considered in a very important manner. And the consent form has to be obtained from the legal representative. Those who are legally the guardian, the child guardian, like parent, mother, father, guardian, or if there is a old age, then it is son or daughter or son-in-law or daughter-in-law. In case of any mental retarded person, like brother, they are also having a right to do that. And respecting the privacy is very, very important when the patient comes to the. Nowadays it has changed a lot, but earlier in OPDs and all, we may not give privacy to the patient while case taking. A homeopathy case taking is very sensitive thing. So what I think is, the first time when I went to a homeopathic doctor for consultation, I was asked so many questions. I was just 15, 16 years old. So you can consider what I should feel. Do you like hot water? Do you like to drink? What type of food you like? So these questions make us very curious. Why these questions are being asked? Why doctor is asking all these questions? So this is the mindset of a person coming to homeopathic hospital or a clinic for the first time. So in that case, if the patient is given some privacy, some solitude, like where he or she can talk freely, when the mother is not there, parent is not there, or when husband is not there, the case taking method becomes even more easier. And not only that, another important issue is when a female takes case for a female or male takes for a male, it is more comfortable, because many a time we may have an uncomfortable feeling with talking to certain important things, or about our likes. Females may feel difficult to talk to a male doctor. So while taking case, it is always good to involve. It is very important in infertility clinics. Very sensitive things happens there, or PCOD, or any condition with certain gynec issues. When females are questioned by a female, it is good. Males are questioned by a male is always good. I don't know whether I am talking the right thing, but I feel it is good, because once it came to the ethical issue about improving the parameters of sperms. So when that study came, it was like about case taking. It was a male doctor who was taking the case, who was the investigator. So it was okay. But it was also told that while case taking, these cases has to be taken by a male doctor. It is good, because females may not feel comfortable. Even female doctors may not feel comfortable unless they are mature. They feel responsible, mature. They will feel so absurd to us, or embracing to ask such questions. So this type of, like, along with confidentiality, along with privacy, that rapport building is very, very important, and feeling free to talk, to give the proper response. That is also very, very important. So respecting the patient's privacy and giving their private information confidential. Another incident to quote is a patient had PCOD. She is just married for 1 year. She didn't conceive. She came with the mother-in-law to the OPD. The doctor is asking certain questions. What was your last LMP? This lady was trying to cover it. When when the doctor asked again and again, this mother-in-law was staring at her, what answer she may give. So this type of situation comes in OPD, and that becomes another root cause for another problem in their life. So these things are very, very important to handle. So respecting their privacy is also a part of privacy. So respecting the right to change their mind. If you are not interested, you can change the doctor, or you can change this medicine, or you can withdraw from the study. That is also giving them freedom to take decision without any penalty. We don't have any penalty. If you leave this study, you have to pay this much. You cannot say like that. So informing them about what may happen in the course of research. You may have you may develop certain symptoms, like you may develop certain dreams at night, or you may feel sleepless at night. So don't worry, it will be okay by 2 days. Like that, in certain drugs, we may have sleeplessness. So while in the drug proving stage, we can inform them or make them comfortable, like night sweating or something. Some symptoms could be informed. And also we have to keep in mind about the expense also. We have to take the charge of the expense borne by them, and also always keep them updated about their treatment, what treatment they are going through, whether the treatment is good, going well, whether the progress is good, or if their progress is bad. You have to openly tell. That is, you're not coming to the part when what I expect. We have to give you some more time. Likewise, give them confidence, but not a wrong information. It is very, very important. Inform them about the what is the good thing came out of. Encourage that because you have involved, you have come to certain very good decision that our study has found effective in this particular condition. So this may help give the confidence. Oh, I'm doing something good for the society. Becoming a volunteer for the study helps me to serve society in some manner. So that, like, how we feel about the patriotism, that feel for society comes to the patient. When you say that, yes, because of your involvement, we have come to a good conclusion that are very good. You are a very good participant. You gave us good information, good cooperation, very good prognosis that my study has come out in a very good manner. Always respect them, give them the priority, give them the what to say, a good reward, like good words, good consideration, and this rapport have to build. The rapport one, because your one patient will be the connection for another 10 patients. So that is very, very important, not only in clinical, not only in research, but in clinical practice also. The way the patient is getting handled is actually leading to the improvement in the clinical that is outlook of a doctor. So that is very, very important. So this is what I wanted to tell. This is a basic thing. In initial condition nowadays, we in homeopathy, we try to include a lot of investigation, which is very much costly, expensive tests are there. For our people, for people who are believing homeopathy or people who are coming to homeopathy, they cannot or they may not afford a large amount. So in our study, if you are planning for doing certain research, then another important thing which should be considered is about the feasibility of the study. Whether we require a lot of money for it, or whether we require some very high-end institution for doing this research, or whether we require a lot of time, or whether we require a lot of samples for the study, or whether we have to collect a lot of blood from this patient. So all this is very, very important, because we cannot, although you are giving free of cost of treatment or investigation, we cannot collect blood from them every time. In children, especially in children, when we do some research, we cannot collect blood from them, especially infants, 1 year, 2-year child. A mother or father will not be, even while giving a vaccination, they will be so much considered. So while taking blood from the patient, while doing investigation with the blood, makes them very much like they may feel, okay, coming here is not a good decision. So that feel should not come. So while doing such research, always try to minimize your study in a non-invasive manner, because invasive procedures, investigations, there is examinations. So this type of things makes the study difficult. And we know that to add scientific validity to our study, we require all this investigation. Sometimes we require MRI scans. We sometimes require X-rays. We sometimes require IgE test. But it's very, very important, but not frequent. The frequency should be reduced, or your study period should be reduced. For example, IgE study. Make the study for 3 months, before, after alone, not for 6 months or something like that, because 6 months, there will be 3 blood investigation. Before the study, after 3 months, and after 6 months. So this makes the things more hectic. Not only you are spending, there is a lot of money from your side, but also patient may feel difficult. So feasibility of the study is very, very important. Make the study very in a narrow, in a focused manner. The objective must be very, very specified, that your aims, your objective is reached without a lot of troubles. There will be trouble in research, but not with a lot of troubles. The troubles which you may create because of your ignorance or less review of literature. Because lesser review of literature, more the problems will be. Updated literature, whether this medicine is, this investigation is appropriate for the particular study. All this has to be properly evaluated before taking up a research. So this is what I want to tell about ethical consideration in research, because this is a very small part. A lot of things are there. And in another time, we will see what are the common ethical issues came by case study. You'll see some case studies where we can discuss about a lot of ethical issues which have came up. And this may give, I told you, ethical consideration is very normal. We may do it, but we may not know that is a issue. So it is a very small differentiating line where unethical and ethical lies. So we may do with ignorance. That is also a part to be reviewed and understood. Only awareness makes us strong in doing a research. So thank you so much, sir, for giving this opportunity. I think 15 minutes is there to discuss.
Definitely, of course. It's a wonderful presentation. As always, we all know that her potential to explain all these things because she is regularly doing this, not just all talking, but doing something. And of course, we all know that regarding the ethical practice and the explanation or recurrent usage of the ethics, who is really showing all sorts of ethics. How can be possible? You know that almost all these studies are often connected to the economics. That is the most important thing.
Yes,
From where all these monies are coming, then why they are investing? What is the modus operandi, or how they are operating is only for making money. That is often, and at the same time giving some hyperbolic idea. This is very good for this, just like we don't know what happened to the studies on our coconut oil, then what happens now? And again, the studies on cholesterol. Even there are a lot of studies just saying that this chicken soup is very good for this common cold. Then they have conducted a lot of studies, they have published a lot of things, but it went. Nothing happened. So there are a lot of studies are there, and it always creating an impression that it's a Hobson's choice, not the Hobson's. So time for discussion, and of course we all, as expected, Sridhar Krupsar is the first person to respond. If anybody would like to participate, you can raise your hand up. Sir, please.
I like to ask you whether it is permitted.
Yes, sir.
Sir,
You can ask.
please ask, sir. Please, sir. What if I know? I'll answer, sir.
Okay. See, in mental cases, you told it is really difficult. Then how the randomized sample study can be conducted in mental patients and mentally retarded and other handicapped people? You please find me.
Yes, sir. So the very important thing is mentally retarded people are actually vulnerable people. They themselves are not able to give any information. That is, it is difficult for getting information from them. If they have some difficulty, they are not able to communicate properly. So this type of group of people are called as vulnerable group. And most important thing is when you take a study with, when you do a study with them, and when there is an aggravation or there is a problem, which cannot be communicated with them, it is difficult to accept such studies. For that, we have to have some placebo control trial. No, in that thing, we have to have an alternate management. If something happens with this, what alternative will I do? And that's what I told you. The management or reference part should be very strong. Otherwise, the studies will not be accepted. Because I told you, like epilepsy, the patient may have epilepsy. We say, I'll be giving this particular medicine for epilepsy. But if the patient suddenly has some seizures, how will you manage it? That should be well defined. There should be some person to take up that particular situation and manage the situation. That's why I told you in situation in cases where there is a vulnerability.
We are having two types of studies.
So,
whether you can hear or not, I don't know. Two types of study. One is with the allopathic medicine side by side. When it is a emergency, example, if the patient may become violent, you can refer the case to allopathic side also.
Yes, sir. Yes, sir.
Along with the homeopathic medicine. That is one method. That is why I asked this. Then another thing that you told, the money must not be involved. But when you are doing that, they're proving, we are giving grants to the students and the provers. Whether then how it can be ethically correct.
That's what I told you, sir. We have a lot of issues. The patient's travel cannot be like a blood donation. A person comes with blood donation. We are giving drinks and fruits to them. That is not driving them. That is just to support because they may be weak, feeling weak, we are giving it. When a student comes with these things, the student should get that, like it is a stipend given to the student rather than giving offer, like not giving 500 rupees. Just I think it's 40 rupees or something being given. I think, Manoj sir, I don't know what amount is being given, but I know that for each prover, some small amount is given as a stipend. Just like a stipend. I don't think it is a very large amount. But in certain clinical study, I mean, by pharmaceutical company, they give 5,000, 1,000 and all. That amount is big. So that's what I
Yes.
mean, sir.
Okay. That I like to ask. That is the thing I like to ask. Okay, thank you very much. Your that class was very excellent. Come
Thank you,
again.
sir.
Go to this excellent.
Yes.
Thank you. Keep it up. Okay.
Okay.
sir.
Yes, now Hariharan sir. Yes, sir, we can unmute now, sir, please. Hariharan sir, please unmute.
Sir, unmute your.
Okay.
Yes,
Okay,
sir.
Okay, Dr. Chandraja, last time I
Yeah.
heard your class. That was very wonderful. Today
Thank
also, it is too much informative for us laymen. It is very, very important. See, doctor, if suppose while you are researching, if some whoever has having some complications, what will we do? And no compensation is provided for them. Is it so?
Not the compensation money will not be given, sir, but because in medical legal cases alone, we have to get the ethical committee is so linked with the medical legal process, because a legal person is there, that is a person like a lawyer is there, notary public lawyer will be there, who will be taking care of our ethical consideration, because informed sheet proper filling will be there, all the points will be verified by them. And also if there is any medical legal problem, and if they ask for compensation, a very large sum and all, they will talk, because in informed consent, it is clearly mentioned. There will be there aggravation to this particular extent. There will be a particular complication to this particular extent. So after that only, after signing that particular document, we'll go for the study. The ethical committee will not give that is clearance for anything which may have a large complication. They will definitely see that, because this lawyer is the person to answer the question. If it becomes a medical legal case, this lawyer will help us to unveil that particular problem. So they will not put any risky patients in this particular study. Well, we go for even with the kidney disease or liver disease, the severe cases will not be taken, sir. So this is very important to selection of samples are very, very important. They will see that in a very particular manner.
Because I have an example like that, so, doctor. You see, my daughter's father-in-law, he allopathic, one allopathic doctor gave him some medicines for diabetes, and within 3 or 4 months, that he will become a chronic kidney patient, and he died. Within 6 months he died.
Very hard. So did he give any consent or something like that to the doctor, sir?
See, a doctor said, excuse, see, please excuse me. And it has happened like that. And see, my son-in-law excused for him, and we omitted that case.
So we may excuse for one time, but if it gets repeated to another patient, another patient who are not a very old person, then every step is very important, sir, because when we excuse a small mistake, that becomes a bigger mistake, because we are also involved in that particular mistake. The thing is, whenever such things comes, it should be notified to the pharmacovigilance department. Pharmacovigilance department will notify, document that by taking this drug, this type of aggravation have happened. So this becomes to the Ministry of Health. They will notify that this drug is having this aggravation. So kindly keep in mind that a person having this complication should not be given this particular drug. So that becomes a law, that becomes a policy later on. So everything which is noted by us, which we understood, has to be properly informed to the authority. Otherwise, some other person will be the victim in the next part, sir. That's what I was told about the pharmacovigilance. We have to know about that also.
Okay, doctor, I know other case also like this. One patient last came to my clinic. That patient has given him some medicines. A doctor at Trivandrum, Trivandrum, and doctor gave him some medicines, and she continued that medicine. After all, what happened is a lump appeared in her breast, and it is examined by the Dr. Gangadharan, and said to her that it may come to as carcinous cancer, and please stop that medicine. Likewise.
Hmm. These are
Okay.
happening, but we
Yes.
don't know who to tell and what to tell.
Yes.
That's why, sir. In
Yes.
many
Okay. We
Of
are
course,
so much ignorant about that, doctor.
yes, sir. Yes, sir. We really doesn't know where to report these things. And this
Okay.
reporting is by incident reporting format. We can report in a proper manner to the authority so that this becomes a, they will keep on investigating these things. More and more data they get in the particular thing, they will pass a law that this medicine should be banned. Otherwise, maybe in the near future, some other person may be affected.
Okay. Yes. Yes, of course. Thank you, sir. Yes, sir. And the most important, interesting and important thing is who is investigating all these things? The compliance. That is the most important. Then there is, of course, some sort of allegiance between the researcher as well as the funding agencies. So definitely, it will take its own course. Not out of that. Now, Dr. Veena is there. Dr. Veena, please unmute and you can ask. Yeah.
Good evening, doctor. Excellent presentation. It's an eye opener for all of us.
Thank you so much.
We are getting informed about all areas about clinical trials and pharmacovigilance. So it's great. Thank you, doctor. But what I wanted to share is, when it is a trial, we have a lot of ethical committee reporting and all those things. When it comes to therapeutics, once the drug is into the market, after which, if there are complications, the reporting mechanism is not so good. So that is where it takes years probably to find out what are the complications this drug may produce in any subject or in any group of subjects.
Yes, ma'am. That is true. Because
so in therapeutic trials, there is no informed consent. There is no reporting mechanism.
yes.
That's a hard fact which we have to accept, and we are all victims for that.
Yes.
Only
True,
we are
true.
even subjecting our own families sometimes when they are not responding to homeopathic drugs, medicines. So we suggest them for allopathy, and we are indirectly giving the consent to do all such type of online research. We have to say, without no reporting and without ethics, all these things are happening. That is a hard fact. We have to accept it. Thank you.
Yes, these are concerns are mere prattling. Nobody would like to accept all these things. If somebody will accept, then the future of the medicine, the modern medicine, will be questioned. Now it's time to wind up the session. May I invite our dearest viewer, Parisa, to express a lot of thanks.
Thank you.
Yes, sir, please.
Good evening, Dr. Chandraja.
Good evening, sir. Good evening, sir.
Congratulations for making an excellent presentation as you used to be. Your presentations are very good. I am deliberately attending your presentations. I think you have made these very important aspects in the in conducting and organizing and conducting the research, ethical and unethical aspects of, because these borderline between the ethical and unethical is very narrow and also involved a lot of gray areas.
Yes,
You
sir.
could explain it very neatly, not exhaustive. You have to cover like a lot of other areas also. I expect you to
Yes,
come
sir.
with more sessions in this aspect, because I'm also very much interested in research aspects. I have a postgraduate in agriculture science, and I have also conducted a lot of research. The biological science research is very, very complicated, not very easy.
Easy.
Yes, it's defining the ethical aspects and unethical aspects of the borderline, etc., are very, very difficult to define. Anyhow, you have made an excellent presentation. You come with more and more aspects of these research areas, and let me express our attitude of gratitude to you, and request is humbly requesting for you coming again and again. All the best. Thank you very much.
Yes.
Thank you, sir. Thank you, sir.
Okay, so I think the Nuremberg Treaty is an important thing. I think I am just requesting you to make some mentions on the coming days. Well, that was the end of today's English session. Hope you to be the same time tomorrow. Till then, goodbye. And it is all Dr. Hubert Silva to continue the program in Malayalam.
Thank you so much, sir.
Doctor.
Thank you, sir.
Thank you, Dr. Manoj, for calling me. And Dr. Chandraja, you made a wonderful presentation. After that, that is another person in the Malayalam session. നമുക്ക് വരുന്നത് വളരെ ജ്ഞാനിയും ചന്ദ്രജ ഡോക്ടറിന്റെ ശേഷം വരുന്ന ഒരു ജ്ഞാനി, വളരെയേറെ ജ്ഞാനിയും വിനയവും ഒരുമിച്ച ഒരു ഡോക്ടറാണ് നമുക്ക് ഇന്നുള്ളത്. ഞങ്ങൾ ഇവിടെ വെച്ച് കാണാനായിട്ട് കഴിഞ്ഞു. അതൊരു വലിയ ഭാഗ്യമാണ്. മുഖത്തോട് മുഖം കാണാനും ഞങ്ങൾക്ക് പരിചയപ്പെടാനും ഒരു ഇതിലൂടെ കണ്ട് പരിചയപ്പെട്ട ഡോക്ടറെ നേരിട്ട് കാണാനും ഡോക്ടറിൻ്റെ ആ വിനീതമായ ആ പെരുമാറ്റ ശൈലിയും അത് വളരെ അട്രാക്റ്റീവാണ്. എല്ലാവർക്കും വളരെയേറെ നമ്മൾ ശ്രദ്ധിക്കേണ്ട ഒരു കാര്യമാണ്. കാരണം ഒരു വിനയവും ജ്ഞാനവും ഒരുമിച്ച് നിൽക്കുന്നതായിട്ട് നമുക്ക് കാണാനായിട്ട് കഴിയും. വിനയമുള്ള ഒരു മനുഷ്യൻ്റെ ജ്ഞാനം നിൽക്കത്തുള്ളൂ. അഹങ്കാരം വരുമ്പോൾ ജ്ഞാനം നഷ്ടപ്പെട്ടുകൊണ്ടിരിക്കും. അതുകൊണ്ട് ആ ഒരു ബ്ലെസ്സിങ് എപ്പോഴും ദൈവത്തിൻ്റെ ഒരു ബ്ലെസ്സിങ് ധാരാളമുള്ള ഒരു ഡോക്ടറാണ്. നമുക്കൊരു നിമിഷം ഡോക്ടറിന് വേണ്ടി പ്രാർത്ഥിക്കാം. നമുക്ക് എല്ലാവർക്കും വളരെ നല്ലൊരു ദിവസം കിട്ടുന്നതിന് വേണ്ടി ഈ നിമിഷങ്ങൾ പ്രാർത്ഥിക്കാം.